health officials are reporting 23 cases of parasitic intestinal infections so far this year. While the number is relatively low, experts do say that it is a good reminder to take precautions and know the symptoms. Joining us to tell us more about this is Dr. Ulysses Wu, Chief Epidemiologist at Hartford Healthcare. Nice to see you.
Thanks for having me again.
Of course. So what is this infection that we've been hearing about, and really how concerning is this?
Yeah, it's not something that's new. It's always concerning because the biggest concern in this case is trying to find where this has what food product this may actually be infecting. And so this what it is a protozoal parasite, and it's usually found in the soil, it's found in water or in contaminated foods. And the way that it gets to us is the contaminated foods have been irrigated with either contaminated soil or water and make its way to us. In the past, it's been found in like raspberries, basil, cilantro, some prepackaged salads, lettuce, things like that. They don't actually have a source quite yet on this one.
Okay, so you're talking about food. So ingesting the foods and not washing the foods or your hands, would you say those are some of the most common ways people become infected with this?
In this country, it's usually through contaminated foods, but in endemic countries where this is more prevalent, yes, it can be from poor hygiene, not washing hands, things like that. But here, if the produce isn't washed, it certainly does increase your risk if it's been contaminated.
And when we say washing our produce, how should we be washing our produce? Is it just the simple run it under the faucet, or is that not enough?
By and large, our produce is safe. I don't want people to think
Right.
that. But in outbreaks like this, unfortunately, again, they don't know what the affected product is. You probably don't actually want to consume that product, but if you are unsure, you do probably want to do an extra rinse rather than just, passing it under the faucet.
And what are some of the symptoms that people should look out for in case they are wondering if they were perhaps infected with this?
Yeah, unfortunately, it's these GI symptoms, and it can be actually some people have been known to have this and have no symptoms at all. But these GI symptoms, you lose your appetite, you become nauseous, you become flatulent, you get abdominal cramping, and then you may have watery diarrhea. It could happen just once. It may actually sometimes last for days. It may actually, the most common would be for several days up to some weeks. But it can actually persist in months, depending on if you have some risk factors that may contribute to that.
And what do we mean by, risk factors? I know you also said some people may be infected and actually never have any of these symptoms. Are there more people who are at a higher risk?
They've looked at these studies, and it is assumed that if you are immunosuppressed, so those who with uncontrolled HIV or those who are undergoing transplant patients, but they've even looked at those patients and they've noticed asymptomatic, what we would say, carriage as well. But they seem to be risk factors where it may be prolonged, and there is treatment, but that treatment may need to also be prolonged as opposed to a standard course.
Right. And I know this may be a big question to ask because, of course, they haven't been able to pinpoint, where this is coming from exactly. But what is something that people can do to reduce the risk of parasitic intestinal infections? Obviously, fruits, vegetables, they are healthy for us. How could we reduce our risks?
Yeah, I think when you're handling any of them, you certainly want to wash your hands. Obviously, if there are any outbreaks or recalls, you don't want to eat that food, but you want to, for the most part, because like you said, fruits and vegetables are healthy for us, and most of our food supply is not contaminated, but you want to maybe do a healthy rinse on a lot of these things and make sure that you wash your hands.
All good advice. Thank you so much. Nice to see you again, Dr. Wu.